Today I wanted to talk a little bit about stem cell therapy for arthritis situations. And arthritis is debilitating in some cases, and in some cases can actually lead to surgery or side effect from medications, or just you don't want to take a medication for arthritis. And so I want to talk about this option, stem cell therapy for the treatment of arthritis. I'm Joya Vanderlaan. I'm a functional medicine and regenerative nurse practitioner, and I practice physically in Illinois, but I'm licensed in a handful of other states. So with arthritis, typically what that is a degeneration of the joint tissues, often the cartilage, over time. That leads to inflammation, and inflammation often will cause pain. And then that can lead to functional challenges and just pain and inability to do the things in your life that you want to do. It's kind of a big deal. Typically, if you are diagnosed with arthritis, there are limited options. Oftentimes you're given NSAIDs, non-steroidal anti-inflammatories, as a way to just manage the pain, but really doesn't do anything to solve the problem. No regeneration of tissues is happening while you're taking Aleve or naproxen or any other NSAID, prescription ones included. If the arthritis gets bad enough and it's, bone on bone, so that cartilage is totally gone, or in other situations, surgery might even be recommended. And it's not that that's never the right option. It's just that if we catch arthritis early enough, then surgery doesn't have to be the choice that you're left with. We can do things to regenerate the tissue in that joint such that you don't need a surgery, or at least we can delay the surgery by a number of years. Stem cells, or Wharton's jelly, typically is what I would inject into a joint. It's a type of regenerative injection, meaning we can inject that Wharton's jelly from an umbilical cord of a born baby. And that actually has very powerful signaling cells to call all your body's resources, its own stem cells included, to that area to regenerate the tissue over the course of weeks to months to even up to a year. Some of the advantages of this over surgery, there are a lot, but you don't have to go in under anesthesia. Nobody's cutting open your joint and messing with the anatomy in there. Nobody's replacing a joint. This is a simple injection straight into the joint, usually under ultrasound guidance, so we know exactly where that needle is going. And it's very low risk. Of course, infection is always a risk whenever you enter a joint space, but as long as the person who's doing it is skilled and experienced and uses sterile or aseptic technique, the risk of infection is very, very low. What does it look like when you come in for a stem cell injection or a Wharton's jelly injection into, for instance, your knee or your elbow, your shoulder? Well, I have the product in little vials that I order specifically for each patient. And I roll it between my hands to get it melted in liquid form because it's been on dry ice, so solidly frozen. Very important that it's kept at the right temperature and kept frozen until it's ready to be used. And then we have about a half an hour to use that. So I will come with it on ice. And then we inject it just like any other joint injection under ultrasound guidance, typically in this case. And it's very simple and easy. People are often surprised it's not a bigger deal, but it's very simple and easy. Stem cells are super safe. There are really no significant side effects from the stem cells. In fact, they're better tolerated than most other injections, and certainly better tolerated than surgery. If you're looking for a less invasive way to not only treat the symptoms of arthritis, but actually heal the disease process, the degeneration going on, regenerative treatments are a wonderful, wonderful option. And I always want to make sure that my patients are optimized in a lot of other ways first. So eating a healthy diet and ideally getting close to their optimal weight, or they're already on the vitamins and nutrients or hormones that they should be on. It's going to work even if those things are not in place. It's just that it's going to work much better if we can get the terrain, the environment that we're injecting into, as healthy as possible first. Stem cell therapy is a really promising therapy. Tons and tons and tons of research is coming out all the time on this. So now we're going from just miraculous anecdotes to actually a lot of studies showing that this does have a huge potential, and it works really well. If you're curious about learning more, I am as you may be able to tell, very excited to talk about this, especially if you're in Illinois or able to travel to Illinois to receive injections with Nourish House Calls. Feel free to book a discovery call, and I'm happy to kind of go over the specifics of your case and see if you might be a good candidate for stem cell therapy or Wharton's jelly injections, or really any of our services. You can book that online on our website, nourishhousecalls.com.